Hello, this is Andrew Tully from Range of Motion Physical Therapy. Today I'm just going to go through some simple Pilates exercises that are designed to help assist with low back pain. They're fairly basic exercises. It is obviously important to get yourself checked out by a qualified therapist before you go about these exercises. But these exercises are really designed to help you get over that maybe acute stage of low back pain and low back stiffness involving the pelvic floor and obviously the pelvis. So first we're going to start off by getting set up into our resting position. So I'm going to require you to sit back, lie down, and get a pillow for your head. You're going to have your feet hip distance apart along with your knees. You're going to have your pelvis in a neutral position. So in order to do that, we tilt our pelvis backwards, flattening the small of our back into the floor, and tilt our pelvis forward. And we do that a few times within our pain range until we feel that our pelvis is in a neutral position. And when it's in a neutral position, you should have a small space underneath the small of your back. You may just be able to slide your fingers into that space. And you want to be able to maintain that space during all the exercises. Secondly, we're looking to turn on our pelvic floor muscles. So these are the muscles that are deep down inside that we would use to help us stop us going to the toilet. So if you imagine you're turning those muscles on, and just turn them on about 30%. And again, maintain those throughout all these exercises at 30%. We're going to have our hands by our sides and just tuck our shoulders back in underneath. And all we're going to do for the moment is just some pelvic tilts. Just try and warm up that lower back, allowing the pelvis to tilt forward and back. So if you're feeling any pain during this movement, just take it as far as the movement allows. Don't push through any pain. Okay, so I might do that for a few minutes just to warm ourselves up. Then what we're going to do is we're going to slowly start to do some small movements. So again, we're just going to stabilize the pelvis, and all we want to do is what's called a one leg slide. So we're going to slide our left leg out nice and gently. Again, making sure it's not causing any pain, and slide it back in again. Move that mat out of the way. So we're going to slide it out, just allowing the heel move along the floor. And again, it's important to maintain neutral pelvis and keep your pelvic floor turned on. So we're going to do 5 on each leg. Nice and slow and controlled. Keeping that pelvis engaged. Don't worry too much about your breathing at this stage. Very good. And then we're just going to change legs. Another 5 on the right leg. Again, making sure the pelvis isn't rocking and rolling. Pelvic floor is engaged. Try to maintain that opposite leg nice and steady, like as if you're able to rest something on the top of the knee there without falling off. Lovely. Okay, so for our next move, we're just going to raise our leg up off the floor. So it's called the scissors. So again, it's to be done within your pain range. If this exercise is too difficult for you to do at this stage, you can skip this exercise. So all we're going to do again is engage our pelvic floor and just lift our knee up so as it's over our hip, maintaining the knee at 90-degree angle. Hold it there for a second and slowly lower and touch the toe off the floor. So again, let's do that 5 times. Again, really trying to monitor what's happening with the pelvis. Make sure it's nice and stable and we're not losing that space underneath the small of our back. And 5. Great. And let's change legs again. Right leg up. And just slowly allowing that toe come down and touch the floor. Trying to maintain control at all times. With the breathing, you should be breathing out on the hard part. So whatever part of raising the leg you find difficult, exhale as you raise your leg. Great. So now we're just going to do a slightly different hip exercise. This is where we're going to allow the hip just to fall, allow the knee to fall out to the side. Again, as far as we can control it, and also as far as we can still maintain our pelvis stability not letting the pelvis rock over to the side that the leg is going to. And again, keeping the pelvic floor engaged. So again, we do 5 reps to each side. And the opposite leg that's not moving, again, should stay nice and steady and only allow that knee to fall down as far as we can control it. Lovely. Okay, so now we're just going to do a simple little hip twist. So with that, we're going to put our 2 legs together, zip them up. So here we're going to just let the legs fall out to the right side. And as we go to the right, we look to the left. So again, we're getting some nice rotation through the lower back. As I said earlier, be careful that this doesn't cause any increase in your symptoms. And when we're doing this exercise, we want to make sure that the opposite shoulder blade stays glued to the floor. So your shoulder blades are basically cemented to the floor when we're letting the knees fall to either side. If you can't keep your shoulder blade glued to the floor, you're letting your knees go too far. And again, as I said earlier, stay within your pain range. So let's do 5 reps to each side with this. Great, okay. So now we're just going to turn on to our side and do some simple side exercises. So when we're on our side, we're going to extend out our arm, rest our head on our pillow. We're going to push our pelvis away from us, so as we're creating a little bit of space in underneath here. We're going to have our feet stuck together and in line with our bum as we look behind ourselves. Hand in front if you need to. Engage your pelvic floor. You're going to keep your feet together and we're going to raise our knee up and down. Okay, so we do that 5 to 8 times. And we're going to change that slightly, whereby we're just going to have our hips slide forward and back. Okay, so we're going to take our leg just off the floor, leg just away from our lower leg, about 1 inch, and we're just going to slide the hip forward. So imagining you're sliding your leg along a glass table. Again, trying to maintain good neutral pelvis. Just have the hip moving forward and back. Don't let it hyperextend through your lower back. Try and keep the pelvis neutral and just slide that knee forward and back. So again, we work between 5 and 8 reps of that. Very good. Keep your hand down just to help with your stability. Lovely. So what we can also do for the hip is just extend out the leg. Engage the core, and we're just going to bring the leg up and down. Again, nice and slow and controlled. Try and maintain good control throughout the whole movement of the leg, all the way up and all the way down. And again, we'll just do 5 to 8 reps on that. Making sure to try and maintain a nice steady pelvis. Great, lovely. So we're just going to change over and do the other side. Same 3 exercises. Arm extended out. Push the pelvis away, engage your core. Feet in line with your bum. Hand down for a bit of stability. And let's go again. We're going to bring 5 to 8 reps of this climb exercise. So this exercise is very good just to help with the strength of the glutes, the lower back, left muscle in the lower back. Again, helping just create a bit of strength and support for the lower back. Right, and then our next exercise is just letting the leg come about an inch off your lower leg and slide that knee forward and back. And again, only taking it within your pain range and where you can control the movement of the pelvis. Don't forget to keep engaged. Lovely. And now we can straighten out our leg. And we're going to do our abduction. So that's just, we're going to take the leg up and down. Again, between 5 to 8 reps, depending on what you can control. Excellent, great. So now we're just going to go on to our front. We're going to do a few simple lower back lumbar mobilizations. So with that, we just want to be on our hands and knees. So with this, we're looking to have our knees below our hips, hands below our shoulders. We want to have a neutral pelvis again. So with that, we don't want to have it tilted too far forward or have our back arched. All we want to do is start in this position here. Draw in your belly button away from the floor. Hold it again about 30%. And all we're going to do is we're going to arch our back, look down between our legs, and then bring our head back up and look up towards the wall in front. So this movement really takes place through the pelvis. So all we're doing is rotating our pelvis forward and backwards. And obviously moving our head to get some thoracic spine mobility. So we might do 10 reps of this again. Nice little loosener outer after the exercise we've just done. Very good. Also what we can do is we can just really wag our tail. So if you imagine that you're trying to wag your tail, so we're going to swing our pelvis out to the one side and then swing it back out to the other side. So really there's very little movement happening in our shoulders, it's all happening in our lower back. So using our lower lumbars to really side bend through our lower back. Again, only moving as far as your pain range will allow. Great, and then after that, those exercises we can sit back and just do a little bit of a child pose. So we're going to sit back on our heels, stretch out our lower back and just get your fingers to pull your shoulders forward and take some nice deep breaths in through your nose, fill your belly and exhale out. So we might do 5 of these. Brilliant. So now we're just going to go down onto the floor, onto our stomach. So when we're on the floor, the way we engage our pelvic floor region is we tilt our pelvis backwards. So we're tucking our tailbones in between our legs really. You'll engage your glutes slightly and then you'll draw your belly button away from the floor. Just thinking maybe there's an ice cube underneath your belly button and you want to draw that belly button away. You're going to have your shoulder blades tucked back and down and we're just going to have our our forehead resting on our hands. And all we want to do is just do a little bit of a back extension. Just going to come up, drawing our chest bone and our head away from the floor. So as we do this, we still keep our chin tucked in. We don't lift our neck up because we don't hurt our neck, so we're going to stay focused on the floor in front. And we're just going to come up as far as we can comfortably go, remembering to keep our belly button drawn in and also working within our pain range. So I might do 5 or 6 of these. And really what we're doing is we're helping to work the muscles between the shoulder blades. I'd also do a little bit of extension through the lower back to help mobilize that. Okay, great. So the next position for that is we just bring our hands out to the side, So our elbows are shoulder height, and all we're going to do here is again tilt the pelvis back, drawing in our belly button. We're just going to come up a little bit higher, still looking at the floor and coming back down. So you're going to be able to go a little bit higher than we were earlier, but still keeping the chin tucked in, looking at the floor. And again, we're going to work maybe 5 to 8 reps of this. And again, staying within your pain range, very important, so we don't aggravate any symptoms that are already there. Okay, very good. And now we're just going to take it a little step higher. So we're going to come right up with a full back extension and see how far you can take this. But ideally what we're trying to do is really lock out the elbows. So just allowing your body to come up, keeping your shoulders back and down, and getting that body up as high as you can. Pause at the top, inhale, and exhale on the way back down. Try 5 of those again, drawing in our belly button, inhale, and exhale as we come back up, and pausing at the top. Again, like everything else with these exercises, stay within your pain range, and you may find if you're doing this once or twice a day, that you can get higher and higher as you go, with less pain. And 5. Okay, so after all that back work, back extension work, let's just come up out of that and flex forward through our, stretch out our back. Again, maybe 3 to 5 deep breaths, breathing in through your nose, filling your belly, and out through your mouth. And back up out of that. Excellent, so that's a nice basic little routine that if you've got some acute low back pain, you can try, as I said, once or twice a day. If you're going to do the exercises, make sure that you're staying within your pain range, that you don't do them in a bed. Get out of bed. If you're doing it in the morning, have your breakfast maybe, put down your mat, and then do them. Don't do them cold, allow the body move around the place. If you'd like to learn more, you can contact Andy Tully at Range of Motion Physical Therapy. Thank you very much.